NLN Nursing Entrance Exam Question Bank. Question 1. Which average results from scores of 65, 69, and 73 in this author purpose item? Option A, 207. Option B, 69. Option C, 67. Option D, 8. The correct answer is option. Add the 3 scores to get 207, then divide by 3 to get 69. The other choices use the sum, the range, only 2 scores, or an added value rather than the mean. Question 2. During a quick next review of a summary task item, which word is closest in meaning to maintain in a patient education passage? Option A, invent. Option B, destroy. Option C, preserve. Option D, compare. The correct answer is option. Maintain means preserve, so that choice matches the meaning in context. Invent means create, not preserve. Destroy means ruin, not preserve. And compare means note similarities or differences, not preserve. Question 3. After checking the choices in a sentence correction item, which answer identifies the substance dissolved in a solution? Option A, solute. Option B, precipitate. Option C, catalyst. Option D, solvent. The correct answer is option. The solute is the material being dissolved. Precipitate is a solid that forms in solution, catalyst speeds a reaction, and solvent does the dissolving. Question 4. If a punctuation review stem gives one clear clue, which choice most accurately summarizes the passage? A report says infection rates fell after staff completed a hand hygiene refresher. Option A, a training increased infection rates. Option B, the refresher removed all risk permanently. Option C, a training may have improved compliance with hygiene practices. Option D, hand hygiene cannot affect infection. The correct answer is option. The sequence suggests training supported better hygiene behavior. Training increased infection rates is not supported by the passage. The refresher removed all risk permanently is not supported by the passage, and hand hygiene cannot affect infection is not supported by the passage. Question 5. When time is limited on a pronoun agreement question, which increase is shown from Monday 17 to Wednesday 27 in a simple practice chart? Option A, 7. Option B, 44. Option C, 27. Option D, 10. The correct answer is option. The increase is the final value minus the starting value, 2717 equals 10. The other choices use the final value alone, only the Monday to Tuesday change, or the sum instead of the difference. Question 6. Given the information in a parallel structure item, which for flow rate delivers 0.75 L over 3 hours using a 10 GTT/ml set? Option A, 42 GTT/min. Option B, 250 GTT/min. Option C, 2500 GTT/min. Option D, 4 GTT/min. The correct answer is option. Convert 0.75 L to 750 ml, then use 750 times 10 divided by 3 times 60 to get about 42 GTT/min. The other choices come from common errors such as skipping the drop factor, using hours instead of minutes, or rounding before the final step. Question 7. Suppose a similar active voice item appears on test day. Which word is closest in meaning to omit in a patient education passage? Option A, leave out. Option B, predict. Option C, include. Option D, polish. The correct answer is option. Omit means leave out, so that choice matches the meaning in context. Predict means forecast, not leave out. Include means put in, not leave out. And polish means make smooth, not leave out. Question 8. While working through a timed capitalization check set, which answer identifies the transfer of heat through direct contact? Option A, conduction. Option B, radiation. Option C, convection. Option D, evaporation. The correct answer is option. Conduction transfers heat when particles collide through direct contact. Radiation transfers energy by waves. Convection moves heat through fluid circulation, and evaporation is liquid changing to gas. Question 9. Before choosing an answer in a clinical scenario item, which choice most accurately summarizes the passage? A clinic sends appointment reminders, and missed visits decline. Option A, appointments no longer need scheduling. Option B, reminders can help patients remember appointments. Option C, patients cannot benefit from reminders. Option D, reminders caused more missed visits. The correct answer is option. The decline in missed visits supports the role of reminders. Appointments no longer need scheduling is not supported by the passage. Patients cannot benefit from reminders is not supported by the passage, and reminders caused more missed visits is not supported by the passage. Question 10. A student sees this community clinic idea on a next review. Which answer identifies the transfer of heat through direct contact? Option A, convection. Option B, radiation. Option C, evaporation. Option D, conduction. The correct answer is option. Conduction transfers heat when particles collide through direct contact. Convection moves heat through fluid circulation, radiation transfers energy by waves, and evaporation is liquid changing to gas. Question 11. One student survey practice problem tests the skill. Which value of x solves 5x plus 8 equals 53? Option A, 9. Option B, 10. Option C, 45. Option D, 8. The correct answer is option. Subtract 8 from both sides to get 5x equals 45, then divide by 5 to find x equals 9. The other choices result from stopping after subtraction, adding 1 too many, or not reversing the operations in the equation. Question 12. Several choices look tempting in a wellness app item. Which word is closest in meaning to prohibit in a patient education passage? Option A, forbid. Option B, permit. Option C, repair. Option D, compare. The correct answer is option. Prohibit means forbid, so that choice matches the meaning in context. Permit means allow, not forbid. Repair means fix, not forbid. And compare means examine likeness or difference, not forbid. Question 13. For this practice timer nursing entrance question, which answer identifies the repeating a study to see if results hold? Option A, bias. Option B, a classification. Option C, estimation. Option D, replication. The correct answer is option. Replication checks whether results are reliable across repeated trials. Bias is a systematic error, classification is grouping items, and estimation is an approximate calculation. Question 14. In a short exam readiness practice STEM, which choice most accurately summarizes the passage? A study found that students who practiced with timed sets felt more comfortable during the actual exam. Option A. The exam has no time pressure. Option B, a timed practice can build exam familiarity. Option C, comfort never changes with practice. Option D, timed sets remove all content gaps. The correct answer is option. The passage connects timed practice with increased comfort. The exam has no time pressure is not supported by the passage, comfort never changes with practice is not supported by the passage, and timed sets remove all content gaps is not supported by the passage. Question 15. Among the choices in a quick review item, which critical thinking response best fits this situation? A test item asks for the best answer, and two choices are true but only one directly answers the STEM. Option A. The longest answer is automatically best. Option B. Any true statement is always best. Option C. The choice that directly answers the STEM should be selected. Option D. The first familiar term should be chosen. The correct answer is option. Entrance exam items often include true distractors that do not answer the specific question. The longest answer is automatically best, does not follow from the situation, any true statement is always best, does not follow from the situation, and the first familiar term should be chosen, does not follow from the situation. Question 16. Using the facts in a hard question, which increase is shown from Monday 12 to Wednesday 17 in a simple practice chart? Option A, 17. Option B, 5. Option C, 3. Option D, 29. The correct answer is option. The increase is the final value minus the starting value, 1712 equals 5. The other choices use the final value alone, only the Monday to Tuesday change, or the sum instead of the difference. Question 17. Based on the clue in a easy question item, which word is closest in meaning to resolve in a patient education passage? Option A, vanish. Option B, decorate. Option C, complicate. Option D, settle. The correct answer is option. Resolve means settle, so that choice matches the meaning in context. Vanish means disappear, not settle. Decorate means adorn, not settle. And complicate means make harder, not settle. Question 18. Consider this high-yield mock test concept. Which answer identifies the tiny vessel where nutrient and gas exchange occurs? Option A, a trachea. Option B, a vein. Option C, capillary. Option D, artery. The correct answer is option. Capillaries have thin walls that allow exchange with tissues. Trachea carries air, vein returns blood to the heart, and artery moves blood away from the heart. Question 19. Near the end of a diagnostic set review session, which statement gives the best main idea of this passage? A patient education sheet used short sentences, headings, and pictures. Option A, clear formatting helps readers understand health information. Option B, long paragraphs are best for patient teaching. Option C, headings reduce the value of information. Option D, pictures make written instructions unnecessary. The correct answer is option. The sheet is designed to improve readability and comprehension. Long paragraphs are best for patient teaching is not supported by the passage. Headings reduce the value of information is not supported by the passage, and pictures make written instructions unnecessary is not supported by the passage. Question 20. Across similar final review nursing entrance questions, which increase is shown from Monday 16 to Wednesday 24 in a simple practice chart? Option A, 5. Option B, 40. Option C, 24. Option D, 8. The correct answer is option. The increase is the final value minus the starting value, 2416 equals 8. The other choices use the final value alone, only the Monday to Tuesday change, or the sum instead of the difference. Question 21. Since only one choice fits the question bank clue, which second quantity matches a 2:4 ratio when the first quantity is 6? Option A, 18. Option B, 12. Option C, 15. Option D, 6. The correct answer is option. The first part grew from 2 to 6, so the scale factor is 3. Multiplying the second part, 4 times 3, gives 12, the other values use the total, the first quantity, or an extra scale step instead. Question 22. From the information in a workbook page item, which word is closest in meaning to summarize in a patient education passage? Option A, condense. Option B, lengthen. Option C, deny. Option D, decorate. The correct answer is option. Summarize means condense, so that choice matches the meaning in context. Lengthen means make longer, not condense. Deny means refuse, not condense. And decorate means adorn, not condense. Question 23. At a testing desk during a study notes review, which answer identifies the organ that produces bile? Option A, pancreas. Option B, kidney. Option C, liver. Option D, gallbladder. The correct answer is option. The liver produces bile, which helps digest fats. Pancreas secretes enzymes and hormones, kidney filters blood, and gallbladder stores bile. Question 24. Inside a revision guide science or skills item, which statement gives the best main idea of this passage? A volunteer program grew after former patients shared personal stories at orientation. Option A, former patients stopped the program. Option B, orientation should never include stories. Option C, personal stories can motivate people to participate. Option D, volunteer programs grow without communication. The correct answer is option. The passage shows participation increased after meaningful stories were shared. Former patients stopped the program is not supported by the passage, orientation should never include stories is not supported by the passage, and volunteer programs grow without communication is not supported by the passage. Question 25. Through careful reading of a crash course STEM, which answer identifies the group that does not receive the experimental treatment? Option A, a conclusion. Option B, a sample. Option C, experimental group. Option D, a control group. The correct answer is option. A control group provides a comparison for the treatment group. Conclusion is the final interpretation, sample is the participants or items studied, and experimental group receives the treatment.